Your loved one is about to have joint replacement surgery. And even though you may be feeling anxious or nervous, there's a lot you can do to help your loved one through surgery and recovery. Think of yourself as the coach, there every step of the way, cheering, supporting, guiding, and helping. Your role as the coach can begin as soon as your loved one plans to have joint replacement surgery. Attend all preoperative meetings with his healthcare provider. At these meetings, write down any instructions to follow and ask all of the questions you may have. Many times, the patient may not think to ask about important details because they are dealing with their own emotions. Be his voice when you need to. Here you will also learn specific exercises your loved one must do to prepare for surgery and recovery afterward. Take the time to understand the correct way to do these exercises. Your loved one may need help, especially after surgery, or a reminder every now and then. If you and your loved one decide that recovering at home is the best option, help to prepare your house before surgery. If possible, create a living space on one floor to avoid stairs. Pre-cook several meals before surgery and freeze them for easy reheating later. And you may want to stay close to home during those first days of recovery, so stock the pantry before surgery. On the day of surgery, drive your loved one to the hospital and help her feel comfortable as she gets settled in. At this point, your loved one may be feeling nervous. Let him talk about his feelings, listen, and give him positive reassurance. After surgery, movement is important to reduce the patient's risk of blood clots and to prevent swelling. You can help. Follow the instructions of all healthcare providers and the physical therapist to get your loved one moving. During the first few days after surgery, your loved one will need help getting in and out of bed safely and, when ready, taking short walks in the hospital. Take those walks with your loved one. You are giving them physical support if needed, but also emotional support along the way. When your loved one is ready to be discharged from the hospital, attend the discharge meeting. At this meeting, the healthcare provider will go over important information, including medications to take, physical activity restrictions, and the date of the patient's follow-up appointment. This is a lot of information. Your loved one may be too overwhelmed or tired to take it all in. Write down the important points so you can refer back to your notes later if needed. And ask any recovery questions you may have now. The healthcare team is there to help. In the days and weeks following joint replacement surgery, be there for the physical recovery. Help him with his exercises on a regular basis. Drive him to physical therapy sessions if needed. Make sure all medications are taken as prescribed and provide healthy, nutritious meals. But also be there emotionally. There will be good days and bad days. Days when your loved one feels less pain and is happy to be active. And days when you may need to encourage him to do his regular exercise routine. Coach him through these difficult days, knowing that better days are ahead as he continues to heal.